people. I just think that's
Yeah.
what it is. I love people. I love knowing that I can help solve their problems. I
Mm-hmm.
felt like, again, being a Black person in that space, that
Mm.
was always something that was acknowledged. Like,
Mm.
you know, the nods from the nurses, even the patients, because sadly I saw a lot of Black patients, male and female, and just seeing a Black advocate, they just felt so much better just walking into
Yeah.
like a bus, walking into the tribunal, walking into their ward rounds and knowing that
Yeah.
they had somebody who could speak for them.
Yeah.
Um, yeah, I think my heart was just really broken just hearing a lot of, especially seeing young people. Um, I just remember actually I went to one hospital in South London,
Mm.
and I met this young guy in there, and he just looked at me because I knew he'd been smoking or whatever and had an episode, and so they took him in, and he didn't know that in being taken into a place like that, and that's your first admission, that could be it for the rest of your life. It's like a revolving door. The way that they will catch you again and catch you again. And I remember he said to me in like a really innocent voice, like Renette, like what's a delinquent? Like what does that mean? And I was just
Mm.
like, is that what they're calling you? Is that in my head? I was like, is that what they're saying to you? So I told him what one was, and I was like, gosh, man, I don't want you to take this path for your life. You know what I mean?
Mm.
Because I could see I was meeting people in their 70s who were basically cabbages, but had started off
Mm.
16.
Really young.
You know what
Yeah.
I mean? And I just thought I've got to stop this guy from starting this path. So
Mm.
it's just you realize what you can do to interrupt somebody's life in a good way,
Mm-hmm.
and just how powerful that was. So
Yeah.
so yeah, I stuck to that field for a long time. Then took a detour off the legal path
Mm-hmm.
and worked for Mind. Um, More because I was in student debt. You
Mm-hmm.
know, doing law is expensive. I took on
Mm-hmm.
a lot of that debt myself, and I couldn't keep up with the payments. I was earning very little as a paralegal. I was bringing home less than £2,000 a month, and half of that was going to my rent and whatever else. And then Bank of
Mm-hmm.
England is saying, "Hey, you owe us how much? You're
Yeah.
working now, girl, so you
Yeah.
owe us this money." So I had to take a detour,
Mm-hmm.
and I didn't know where I was going. I didn't know I was going to qualify,
Mm-hmm.
and I found a job working for Mind, and they said, "Look, I was 25 at the time,
Mm-hmm.
24." And they said, we're looking for a project manager to set up an advocacy service.
Mm-hmm.
Got the interview, got the job. I was
Mm-hmm.
like, okay, what do I do now? And I just did exactly what I did as a paralegal. I
Yeah.
went in the community. This is based in West London.
Mm-hmm.
I went to Fulham. I went to day centres. I went to hospitals
Mm-hmm.
and just talked to people. And
Mm-hmm.
I met people, and I built up this advocacy service where I learned about what happens to them once they come out of hospital. Because in
Mm-hmm.
hospital, hard work goes on. Lawyers are in there beating down the door because there's money and there's people. But once they're out,
Mm-hmm.
because it is a business at the end of the day, let's be
Mm.
real, as much
Yeah.
as we're helping, it's a business.
Mm-hmm.
Once they're out, nobody's really thinking about what happens to them. And that's where I was meeting them now,
Mm-hmm.
working for Mind. And they were dealing with primary health care
Mm-hmm.
as people with schizophrenia, bipolar, other conditions,
Mm-hmm.
and going to GPs and saying, I've got a headache, or I've got a pain in my stomach, or I think there's something going on. I've lost my appetite. And the GP's like, what's on your notes? Oh, you got paranoid schizophrenia. Okay. All right.
Mm.
Well, okay. Well, and just
Yeah.
parking them
Yeah.
because they're thinking you're crazy. This is just one of your illusions again. So none
Mm-hmm.
of their primary health needs were being met.
Mm-hmm.
And I was like, wow. So people aren't listening. People aren't even believing you no more.
Yeah.
No one's taking care of you.
Mm-hmm.
So I was in. I don't think I singly did this,
Mm-hmm.
but advocated for double appointments for people like that
Mm-hmm.
because they needed time to tell their stories after they've said whatever didn't make sense to you in that first 10 minutes. They need another 10 minutes to actually tell you,
Mm-hmm.
this is my condition
Yeah.
and you need to examine me.
Mm-hmm.
Or if somebody can't be there for them, like an advocate or support worker, you need to give them grace to let them get a CT scan.
Mm-hmm.
Give them a bit more time.
Yeah.
So I was just, when you meet people face to face,
Mm-hmm.
um, I was going to Rampton, I was going to Broadmoor, I was going to secure prisons
Mm-hmm.
and seeing women who were self-harming, but had, really complex childhood and stories, and
Mm.
then were where do I go after I leave prison?
Mhm.
You know, what happens to me? You can't leave that kind of, it's no longer a job anymore.
Yeah.
It feels like a responsibility.
Mhm.
And I think the pressures of work makes you feel like, it reminds you it's a job. But
Mhm.
and this is something my manager always used to say to me, say, Renette, when you walk out that door, when you walk out that hospital door, they're still there, you know.
Mhm.
They still have to wake up to a nurse
Mhm.
over them with their tablets and stuff.
Mhm.
You can go back to your bed and sleep and watch your Netflix and whatever.
Mhm.
So think about that. Think of,
Mhm.
you know, on those
Yeah.
days when you don't feel like pushing that deadline or getting that statement done,
Mhm.
they're relying on you. And I'm
Yeah.
like,